muscles, they try to have you breathe to open up your windpipe, but something is obstructing your flow, your windpipe, the air from going into your lungs, then we'll call that obstructive sleep apnea. Obstructive sleep apnea is actually more common than central sleep apnea. And we will be talking about obstructive sleep apnea mainly today. Now, let's start by even talking about what are some of the risk factors, what are some of the things that can predispose you, that can make you more at risk for sleep apnea. Age, number one. As we get older, so as we get older, as you get older, your risk of getting sleep apnea increases. Okay. Gender, especially even up to your 60s. Larry boy, please mute. I don't want to lose my focus. Yes. So thank you for joining though. So as you get older, the risk of sleep apnea increases, especially up to your 60s and 70s. And there's a reason why we can talk about it later on. Gender. Males are about 2 to 3 times more likely to have sleep apnea compared to females. However, females who are premenopausal or perimenopausal, meaning pre or post, they do actually have an increased risk similar to those of males. Okay. Now, another risk factor is obesity. Especially the more obese you are, then your chances of getting sleep apnea also increases. In fact, if you gain weight, if you gain just 10% of weight, of weight gain, that can actually put you up to 6 times the risk of sleep apnea. And then if you lose 2, that can help. However, there are some people who are, please mute. Where is that coming from? Please mute. So, however, some people may be thin and they still have sleep apnea. And in those cases, most of the time, it is because they have some structural or facial anatomy that puts them at risk. Meaning that, for instance, you may have some people with large tongue, okay? And it could be from a particular medical disease that may cause a large tongue, or just by their nature or genetically, they have large tongues. So you could have a large tongue, or in little children, actually, you may have a little child that is snoring a lot and they look like they can't breathe or they stop breathing. They may have a large tonsil or a uvula. So anything that crowds the windpipe and causes obstruction can cause obstructive sleep apnea. So you do have also some people, which you may have some people, or you or someone whose mandible, the chin, you could see that the chin is either placed and pushed posteriorly, what they call retronychia. So just because of the way the facial muscles are, if you have an underdeveloped chin, a small chin, some people may have like really small chin, that can also, anything that causes crowding of your windpipe will do that. So that's another risk factor for obstructive sleep apnea. Okay. So now, let's talk about what are some of the symptoms. What are some of the things that if you have, you can suspect that maybe you have sleep apnea, or maybe your family members can notice. Okay. The snoring is a symptom that you can have. Okay. Loud snoring. You may be feeling fatigue. If during the day you just feel tired and run down. Okay. If you feel sleepy, you may even be sitting and watching TV or reading a book, or you may be a passenger in a car, you're driving and you just feel sleepy. And if you snore and you feel sleepy, then, and you have some of these risk factors that I mentioned, you have to start suspecting that maybe you have sleep apnea. Sometimes some people wake up at night multiple times. They're not sure why they wake up. They just turn and, like just restless when they're sleeping. Sometimes you wake up gasping for air even. You can't breathe. You like wake up coughing even. You're not sure why you're doing that. Sometimes your bed partner may watch you and realize that you look like your bed partner may watch you and realize that you look like you stop breathing. That's what they call apnea. Okay, so that's another symptom that you can have. Sometimes some people wake up and they have headaches in the morning. So what they call morning headaches. That could also be present in sleep apnea patients. Some people wake up at night to urinate a lot, what we call nocturia. So they may be waking up several times at night to urinate. So you see that you have the daytime fatigue, sleepiness. Sometimes you can't even focus because you didn't sleep well at night. You find yourself waking up at night, not even understanding why you're waking up. Maybe you wake up choking or coughing. Someone that's watching you realizes that you're actually not breathing, or you're waking up multiple times to urinate. All of those are symptoms that if you have, and then you have some of those risk factors that I mentioned, then you have to get checked. Now, let's come to the very important reason why